Hi, this is the TV Checkup web podcast on WebMD. This week we're talking about an episode of House that has two important stories. Of course, there's the usual medical story, what does the person have? But there's a very important backstory that we need to share today as well. In case you didn't catch this episode, it starts with the story of a young woman who's a test pilot. She flies jets and she's applied to be a member of the astronaut corps. But she has a problem. She develops these visual hallucinations during one of these test flights, and she doesn't want to be disqualified from the astronaut program. So she brings a sack of cash to House and says, I want you to work up my problem, tell me what I have, and treat me, but don't tell NASA. Well, naturally, House, who likes to bend the rules, takes the bait and takes her on as one of his special patients. The issue I first want to talk about, though, is the backstory. Here's the situation now where the patient is trying to dictate the conditions of medical care. I like to use the metaphor of the bus when I describe the paradigm of healthcare. That is to say, patients come aboard the bus as a passenger. The driver, the physician, is a qualified individual very skilled at operating the bus. As long as the doctor is driving the bus, it ordinarily will go where it's supposed to go and get there on time, and everyone will have a safe ride. But there could be a problem if a passenger comes forward, a patient, and tries to hijack the bus and take it someplace where it's not supposed to be. A passenger not experienced in operating a bus will find it very difficult to navigate turns and may all of a sudden be driving too fast when they don't want to be, and lo and behold, that bus could go off the road. This story is definitely a situation of a patient trying to drive the bus, and that situation is called VIP medicine. Boy, it sounds good, VIP medicine. You show up in a limousine and they put you in a very nicely decorated room and you've got a staff of ward personnel and nurses who are there to kiss your butt. Now, VIP medicine doesn't work that way. Because of the special circumstances of VIPs and their need for privacy and secrecy, this week in House, that young astronaut candidate was dictating the rules and wanted VIP treatment. And because of that, in each and every scene, there was a disastrous complication because the doctors didn't do things the way they were supposed to do, the way they were trained to do. Believe me, the quality of care that's delivered under VIP medicine is far inferior than the care provided to the poorest, neediest patients in the most busy, overworked, indigent care hospital in the most crowded city in this country. Stay away from VIP medicine and do things the way you're supposed to. Now, back to the story. After all the usual running around and detective work, they found out that this woman was suffering from von Hippel-Lindau disease. Now, von Hippel-Lindau is named after two doctors nearly a century ago. That's right, they name it after the doctors. They rarely name medical conditions after patients. Well, Lindau was the neuropathologist, a German, and he identified a series of patients that had a tumor in the brain caused by an abnormal growth of blood vessels. It wasn't a cancerous growth, but it could cause a lot of neurologic problems. Meanwhile, Dr. von Hippel was the Austrian ophthalmologist. And in a similar group of patients, he discovered that not only did they have the lump inside their brain, but they also had visible findings on their retina, small blood vessel growths on the retina in association with the mass in the brain. Combine the two, these patients have von Hippel-Lindau. It's a rare condition, but it's important to know about because it is one of the familial cancer syndromes or family cancer syndromes. People who have von Hippel-Lindau have a mutation on chromosome 3. Because of that mutation, not only do they get vascular tumors in their brain and in their eye, but they also can get some malignant cancers. One is renal cell carcinoma, and that's a deadly cancer that arises in the kidneys. And the problem with von Hippel-Lindau is, in nearly half of the patients, they get the tumor in both kidneys. You lose both kidneys. That can't be good for you. Another problem they get is another tumor called pheochromocytoma, which occurs in the adrenal gland. And you've probably heard about the adrenals. They sit up just a little bit north of the kidneys, and they control many, many different endocrine activities in our body, including the synthesis of steroids and other neurotransmitters. It was probably a burst of neurotransmitters that gave this young astronaut wannabe the visual symptoms that drove her to House in the first place. A moral conflict arises should House notify NASA of this problem. And you had to wait to almost the very last frame of the show to find out, no, he decided not to tell NASA. It doesn't matter. The medical team at NASA, when evaluating this candidate, would very easily find the problems, and here's why. Every patient who has von Hippel-Lindau has one of these lesions already growing in their eye. It's hard to believe in this fictional TV story that this woman came this far along in aviation career and nobody looked in her eyes. It's just a fine point. I hope you enjoyed the episode of this young astronaut in trouble with von Hippel-Lindau who tried to rock the boat by demanding VIP treatment. Remember, just be a patient and do things the right way. Well, that's it for this episode of WebMD's TV Checkup. I'm Dr. Bill Lloyd. I look forward to seeing you again next time.